This episode of Fertile Talks is sponsored by ilmeds.co, an international mail order pharmacy specializing in fertility medications. If you're looking to save significantly on your fertility treatments without compromising on quality, ilmeds.co is an excellent choice, offering up to 80% of retail prices. And as a special offer to our listeners, use the code FT24 at checkout to receive a $50 discount on your order. For your convenience, you can find a link to their website in the episode show notes. Thank you, and let's get started. Welcome to Fertile Talks, the global podcast celebrating the diversity of fertility journeys. I'm your host, Dr. Yemi Famuyiwa. Whether you're just starting or simply curious, this is your safe space. In each episode, we will bring you expert insights, heartfelt personal stories, and the latest in reproductive health. Our goal is to break down barriers, tackle stigma, and provide support and hope. So whether you're in the Americas, Africa, or Asia, Fertile Talks is your companion on the path to parenthood. Thank you for tuning in and welcome to Fertile Talks.
Hi, everyone. My name is John Faulkner, and I'm your host of the Smarter Systems, Better Care podcast. I'm here today with Dr. Famuyiwa. She's with Montgomery Fertility Center. Thank you for joining us today.
Thank you very much, John. I appreciate it.
Yeah. And just to kick us off, tell us a bit about your background, how you got to where you are today.
Yeah. How much time do you have?
Hey, go for it. It's open forum.
So I'm originally from Nigeria, was born, raised there, and came to America after I did half of my A levels. And I don't think there's an equivalent of A levels here. Maybe the IB program might be the equivalent. I don't know. So anyway, I went to Kent State in Ohio for my undergrad. And as part of that, I did a summer abroad at Holland, Leiden University. So I finished that in about 2.5 years and then did medical school at Emory in Atlanta. And after medical school, I did my OBGYN residency at Georgetown University. It was a great experience. I loved it and wanted to do reproductive endocrinology and infertility because I was fascinated, frankly, with the science of it and interviewed all over the country, but settled on the National Institute of Health because it's in Bethesda, Maryland, which is close by. Experience. Finished my fellowship and stayed on an extra 3 years just doing basic research because it was fun. It was intoxicating. You know, we were doing basic science research, presenting at different meetings. And then I decided I really, really like the patient care more than I liked the basic science.
Yeah.
So when I left NIH, I started my practice, Montgomery Fertility, and have been doing it since. And a few years ago, I created an egg bank to go with it, and that's been doing well. And last year, I started my own podcast called Fertile Talks, and I'm in the process of finishing a book. It's in final revision called The Quest for Fertility. That's going to be out this March.
Yeah. Tell us more about your book.
Well, my book is called The Quest for Fertility, and it's focused more on my aim and mission is to help people understand the fertility journey, and not even if they're on it right away or even if they one day think they might want to have children. I want to give them the tools and the information and the knowledge that would help them. But the way I choose to go about it in this book is to tell the story of the science of it through individual anonymized patient stories, because we human beings are geared for storytelling. I can teach you something when I first tell you a story, right? And then you go, oh, wow, I can see my story in that story. So that's going to be the background, and explore the cultural aspects of fertility, the spiritual aspects of fertility, the emotional aspects of fertility, not just the science. It's not about cold science. There's more to it.
Yeah, that sounds like it's going to be a really thought-provoking book, and I'm sure people get a lot of reading that and learning from it as well. Sounds like you have the human aspect, but also the scientific aspect as well,
And that's the
which
goal.
is critical.
Yes, that is absolutely the goal. I've had several early my beta readers. I had Mr. Jack Canfield. Do you know him? He's
I
the
do not know. Yeah.
he's the author of Chicken Soup for the Soul. Do you know that?
Yes. Yeah. I'm very familiar with that one. Yep.
Yes, yeah. He's the author of that and the Success Principle. So I went to his camp and I read part of my book to him, and he was really fascinated. So he gave us our forward and advance glowing
That's amazing.
reviews, if you will.
Yeah. Yeah. That's amazing. What's the launch date for that when you are releasing it?
March 2026. The pre-sale launched in August, but it's going to be March 2026. And once I get the exact date from the publisher, we're going to be having book tours to
Oh,
4
nice.
cities around the U.S., one of which will be in the Rockville, D.C., DMV metro area, of course.
Like, congratulations on that. That's a huge accomplishment.
Thank
And
you.
then have you written other books as well?
I did. When I was in medical school, I co-authored a book called Contraceptive Technology.
Okay.
This is many, many, many years ago. I helped write a chapter. So it was authored by several people. I helped write a chapter. And then, of course, as a fellow, I co-authored a book on, it's more science related, on insulin growth factor receptors, technical. And then last year, I co-authored a book by other doctors just talking about our journey and our stories. And it's entitled Made for More, number
Hmm.
2. So
Okay.
that was the most recent one. So this will be my solo book that I'm writing, The Quest for Fertility, and also my fourth book.
Excellent. And then you talked about contraceptive technology. I know that's like
Yeah.
a big topic right now.
Yeah.
I see all these health tech companies coming out with new and great things. Like, what are you finding right now that actually works in your own practice with patients?
So, well, that's kind of loaded because you have to look at patients by age group, right?
Okay.
Fertility is more related to the age of a woman, right?
Yeah.
So the sooner we see the patients, the better our success rates. There's new research coming out trying to reverse the effect of age. It's in the just raw science stage. It's not prime time yet. So the best things that we do have right now is really try to prevent and then get people to the fertility centers sooner rather than later when the eggs are aging. So
Mm.
prevention, early intervention would probably be the big key things.
How do you accomplish that? Because I know that from family members, they have to go to their OBGYN and then they're
Yeah,
referred
yes,
to
yeah.
someone like yourself. How do you help prevent that or make that a
Yeah.
smoother process?
So, yeah, first off, I do partner with a lot of my colleagues who are family doctors and OBGYNs. I go on their podcast, I talk on their platform, so they know me and they send me patients.
Yeah.
So that's a lot with collaborating with my colleagues in other fields of fertility. But more than that, I'm very proactive with trying to get my message out there. So I do a lot of blogging, and
As
sometimes we
well.
get a little technical. So I have a YouTube channel that's actually meant for my patients, but I use it as a teaching tool. It's at Montgomery Fertility. So I can teach and explain things to patients. And actually, it's from my YouTube channel that my podcast spun off. So on the
Mm.
podcast, I may tell patients, I want you to go watch the YouTube correlate of this episode, because on there I can show you slides of sperm or eggs, and I use it more as a teaching tool. And then aside from that, I also write blogs. So I have a Substack that I just started this year that's growing. People are signing up. But more importantly, I write articles for Kevin MD. I don't know if you're
Mm.
familiar with Kevin
I'm
MD.
familiar with that. Yeah.
Yeah, so I write several articles and he loves my articles because I tend to be more on the educational side. So he keeps saying, yeah,
Yeah.
come on, more, more, more.
Yeah. People love that.
Yeah, I probably write at least one article every other month in Kevin MD. So I'm
Pretty frequently. Yeah.
very prolific.
Yeah, it sounds like so your technology that we're talking about today in fertility is more about kind of like social media or education based. Is that correct?
Social
Is it a
media
lot
and
of
education based just for outreach.
yeah, for
But
outreach. Okay.
but in the fertility space, AI is huge right now, right?
Yeah.
We're using AI to improve our treatment strategies. We're using AI to help in the embryo lab. There's a company right now that is using AI and has created robotics where they've pretty much used AI and robotics to replace the entire embryology laboratory. So that may be the wave of the future. That's new. Everybody has it.
Yeah, that would be a disruptor.
Yeah. And also with AI, we're understanding more about the human genome. We're understanding more about the genetics, so we can help to prevent severe diseases, especially those that may not be compatible with life. So that is huge right now in the fertility space.
Yeah, and kind of going along the human genome, is there like mapping that's happening, or how does that work in fertility?
Well, I mean, in fertility can do before for the embryo, you would biopsy an embryo and target specific genes that you know may be abnormal to try to
Yeah.
figure out is this embryo abnormal or not, right? But as the technology has expanded, you can take the same biopsy and amplify the DNA. So now you can actually, the newer science is looking at the entire genome of the embryo, trying to figure out how can we use this data to help prevent severe diseases. Now, along with all that, you have to be careful, right? There are good uses and bad uses.
Yeah. What are some like examples of like ethical cases or things you've encountered? You don't have to give names, but just like things you
Yeah.
encountered through in the past in your practice.
Well, so the whole genome thing is exploding right now. So I personally haven't encountered a whole lot of
Yeah.
ethical issues. But so I don't know that I've encountered it. Most of what I've used it for, it would be for patients that have autosomal dominant, meaning they're positive for a genes that causes cancer, right?
Yeah.
And they're
Yeah.
having to go get surgery every day or something like that. So they don't want their children to suffer through that. So we did a genetic screening to see and try to make sure the embryo they have is completely free of that tumor. Well, they only had one embryo and it wasn't completely free. It was a recessive, but it was better than having the full-blown disease. Another one is patients who have sickle cell disease, which is
Mm.
a very debilitating illness where patients have blood cells, their hemoglobin, it sickles, like it stacks one on top of each other like paper plates. Instead of the nice indented round red blood cell shape, they have sickle shaped cells that
Yeah.
doesn't flow through blood vessels very well. So when they stack on top of each other like saucer plates, they actually just block the artery that they're in or the vessel they're in, and they cause an infarction beyond that.
Mm.
So patients are in pain, Until recently, the lifespan of people with those diseases is very short. So if it's something that you can help correct with genetics or prevent with genetics, then that is doing good, right? The
Yeah.
same thing with patients who may have cystic fibrosis, who can't breathe, right? Because their lungs are always clogged with thick mucus and they don't have a long lifespan either, right? They usually die before they're 40. So can you use AI and genetics and your genome data to help to prevent that so that someone has a reasonable chance of a normal lifespan, right? So those would be where you would use those kind of data.
Yeah. So it sounds like you're trying to use technology to have better outcomes
Yes.
with the pregnancy
Yeah.
with your patients. And what do those conversations look like with the patients as you're working with them to help educate and make them and give them like the best options,
Yeah,
I guess.
so most of the patients that come to me with something like that are referred to me.
Mm.
So they already know, or they seek me out, right? And we have this conversation, and the first thing is, Doc, I just don't want my child to suffer through this. Or someone who came to me and said, when I was growing up, I had a younger sister and she had XYZ disease and I saw my parents suffer with her and she eventually passed away at age 4 because it's not compatible with life
Yeah.
beyond. And I don't want that for my child, right? So I usually just start out with expectations. What is your understanding?
Hmm.
And then I can now educate and shed more light.
Yeah. That's a good way to get a good foundation,
Yeah.
especially with, social media out there. There's just so many messages being sent out and things
Yes.
going on.
Yeah.
So I assume you probably do that just to get a baseline of their understanding so you can
Absolutely. Well, yeah.
fill in the
I mean,
gaps.
you know, you mentioned social media, and that's another thing. I'm on social media. I'm on TikTok. I'm on Instagram. I'm on LinkedIn because I get professional connections, and of course, I do my YouTube channel. And now I have started my Substack. But I believe that we clinicians owe it to our patients to put out scientific based
Yeah.
information. We owe it to them to teach them in an unbiased fashion. There was a recent law passed in China that health influencers cannot post about health topics unless they have a college degree, right?
Really
I mean, yeah,
interesting.
yeah, that just
Yeah.
came up because they say people are saying, well, swallow this pill in the morning and take that oil in the evening and it'll cure everything. We've heard that before,
Yeah.
snake oil, right?
Snake.
And it's being pitched by people who are not even in the medical field, no relation whatsoever. But if they have a powerful influencer group, if they have a 1 million following, people are going to listen to them.
Yeah.
Whereas, physicians, we may have a lower following, right? Because we don't know how to do all the bells and whistles and flashy stuff on
Yeah.
YouTube. We're not as educated on things that really, they call it what, clickbait, to make people stop
Yeah.
scrolling.
Clickbait.
So those people are making more noise, and some good, but some bad, some harmful. So like I'll see patients who've gone and done some therapy. I won't mention names. And then they come to me. I'm like, oh, I, why would you do that? Why didn't you talk to your doctor? Why didn't you talk to your family practitioner? Or
Yeah.
why didn't you talk to, oh, I saw this thing on TikTok and so that is spreading the wrong information. We, the clinicians, we, the scientists, we need to put out our truth out there. And that's
Yeah.
what I'm trying to do with my social media.
And there's a lot of physicians right now that are looking for alternatives and they may be burned out or mentally drained.
Right.
What have you learned in your process on being on all these different social media channels? Like what helps you actually get engagement from potential patients or just people in general, like the general public? Because a lot of people try and they get maybe 100 or 200 views, but they're not really getting a lot of engagement.
That is a good point. I'm not sure I have the exact answer. I just believe in putting my truth out there.
Truth out. Yeah.
Yeah, and I've been growing organically. So I don't know that I found the right formula, but I've been putting my truth. I mean, how did you find me? You saw me
Yeah.
somewhere,
Mm-hmm.
right? I mean,
Yep.
by the way, where did you find me anyway?
I think Don found you through my wife. My wife's a physician. So she found you on LinkedIn and she thought you'd be an
Okay.
excellent person on the podcast. So
Oh, how about that?
yeah.
See,
Yeah.
so again, putting my truth out there, putting myself out there, and not compromising on who I am, right?
Yeah.
So
Right.
just believe in representing what I believe in and putting it out there. And then there will be people who recognize, like your wife, and say, wow, I kind of like her message. And of course, my patients are my loyal fans, and they spread the word like, wow, you've got to talk to our doctor, or my doctor is the best. And, I get all these Google reviews where they brag about me. And I'm humbled and honored that they do that, right? But I just believe in putting my truth out there and doing my best for my patients, right? I love what I do and I feel very passionate about what I do.
Yeah.
So I get up with a spring in my step every single day because I just love, I really, really, I nerdishly love what I do. I get into my zone, my flow when I'm doing what I'm doing.
Yeah. Do you have like getting kind of more of the social media part? Do you have like certain times in the week when you just create content or like what does that look like to help other people out?
Well, I'm not very rigidly structured by that. What I do is I journal a lot. So I have a
Mm,
journal here. So sometimes ideas strike me in the middle of who knows where, and I quickly
just write
write.
it down. Yeah.
And sometimes, like yesterday, was I wrote about counseling is not keeping up with the data, and I explored it, and an idea comes and it won't let me go. That's the
Yeah.
way I put it.
You just keep
So,
diving in.
yeah, so I keep diving in. So in fact, I have to be disciplined to stop. Now, my kids will say, "Mom, you sit in your study, and before you know it, it's midnight or 1
Yeah,
a.m.
exactly.
I have to set an
It's because you
alarm."
love what you do. Yeah.
Yes. So I do it all the time, and then I'll set aside longer times. So on a weekend, I have more time. So I develop my topics and decide, am I going to write it as a Kevin article or Substack, and am I going to present it in a podcast version? If the information is critical and really detailed, I'll actually do a PowerPoint
Oh, interesting. Yeah.
I'll record it sharing the screen, because I believe at that point, the data that I'm trying to teach, it's like when you're on the blackboard, you got to show people so they can actually understand it and follow along. So that's the way I do it.
I like that. You have a really creative process in there. Have you found any of these? Because I know you're on a lot of different social media. Have you found like TikTok to be more productive for you, or other channels, out of
Um,
curiosity,
I
recently?
like LinkedIn
Yeah.
only because I get to interact with my colleagues. So I do a lot on LinkedIn. TikTok, the algorithm favors spreading your word, so that's really, really good. But TikTok is not my primary. I really might do it on Instagram, so I'm more Instagram
Yeah.
person. But then I have an assistant that will now take my stuff and then put it on Instagram, and then we have it set up so that whatever I post on Instagram automatically shares to Facebook. So
Instantly.
I
Right.
know a lot of people are good on Facebook. I'm not I have to make myself go there to see what's going on. So the two avenues that I interact with the most are LinkedIn and Instagram. And then from there, we might spin something to X, Twitter, or to Threads from Instagram, or to the new Blue Sky.
Yeah.
But it's mostly from Instagram and LinkedIn.
Okay. And then have you found any tools to be helpful? Because I know there's a lot of things that create reels and do all sorts of things. So is anything new or exciting you've been using?
Well, so I have been very fortunate. When I first started doing this, I used to do this all by myself. So
Yeah.
then I was really spending 5, 6 hours every single night just creating posts. But I have two wonderful virtual assistants now. So I just
Excellent.
give them the
Okay.
raw video and let them figure out how to do those things.
Yeah, that it does take a lot of work to create the content. I think that's what people
Yeah.
forget is they say, "Wow, this person has a million views. It seems so easy," but it's not. They may
No.
spend 5 or 6 hours on that one post.
Yeah. I
So
have one person who does my podcast and another person who does, and then you have to meet with them and make corrections and, make sure that,
edits.
yeah.
Yeah. And then getting into other topics as well, like another hot topic right now is like a Tylenol topic. We've heard
Well,
about that. And it came out about a month or two ago, and then it seemed to have switched like yesterday, where
yeah.
now they're kind of going back on what they said. So I
Mm.
just want to get your unbiased opinion of,
I mean,
educating our patients.
so that was focused on pregnant women, which I really
Yeah.
don't take care of. I take care of women
Yeah.
trying to get pregnant, but
Trying
I
to get
do,
pregnant.
yeah. So the American College of OBGYN has come out to say that we believe that women who need Tylenol during pregnancy can safely take it. Of course, you have to work with your doctor. So I would probably just defer to that official statement. Yeah.
Yeah. Yeah. Talk to them and get some more
Yeah.
questions answered.
Yeah.
Yeah. Um, and then, are there any other topics that you wanted to discuss today that we haven't covered? I know we talked
No,
about
no,
your
well,
book.
let me tell you, I started this initiative this year called Fertile Walk 2012. We started with Fertile Walk 2025.
Yeah,
And so everything I've been doing is on the internet, right? It's on people out there. So this is more where I am. And we were very pleased. We had a gym come co-sponsor with us. They sent their fitness expert. We had a Kung Fu master who led us in Tai
wow,
Chi, and our office premises, it's kind of wooded lot out here, is really beautiful, allowed us to do it. And I was surprised by the enormous turnout of the community. I had different companies calling us and say, we want to be a sponsor. Different companies sponsoring. They wanted to showcase themselves, functional medicine, a vitamin supplement company, a surrogacy company, a fertility support company, even one of the genetics company came out to support, and it grew beyond my wildest dreams. It was so successful that we're trying to create a prep course spinning off from it after that. People have reached out to us and now asking about next year. And so I think it's only gonna be bigger.
Yeah, that's exciting. Something that you're growing for sure.
Yeah.
The other thing I was asked about too is, kind of like your vision in the future. Like, where do you want to go from here? And not even for yourself, but fertility in general. Like, what would be your ideal? Like, where do you want to see things go?
Well, I think that more and more we're going to be getting AI involved, right? So we're going to be getting more AI integrated with the equipment we use in the lab, integrated with our electronic records, helping us make better choices for patients. So we've been collaborating and, it's a little preliminary right now, but we're probably going to have an overseas branch. And
Well, that's exciting. Nice.
yeah,
Yeah.
that's in the work, and there's going to be a collaboration. So I'm excited about that. We're going to continue expanding the Fertile Walk, and we're trademarking it, and we want it to become a national movement with local chapters in different cities. Once we have everything set up, and I want to keep educating people. So I want to see my podcast reach out to more, and as new science and data is coming in, to use that as a channel of education. Now, probably in the future too, because of course, when you write a book, you're writing with what you have right now, and then things change beyond the book. So I would like to see my book grow into a second edition. Is going to be The Quest for Fertility 2.0, and hopefully see it translated into several languages overseas.
Yeah, that's exciting. And then we kind of talked about a kind of tertiary mindset for your patients when you're working with them, because you can help them with the science and the education, but how do you help your patients with their mindset? Because a lot of time,
Yeah.
it's obviously a very stressful experience,
Yes.
but how
Yes.
do you keep them positive and
Yes.
moving forward?
So first off, I do encourage them to work with counselors if they need it, support groups if they need it. And we do work with either counselors or psychiatrists as they need it, and it's been very successful. But you're right, it's very stressful. And when you're stressed, your cortisol level goes up, your fight or flight comes up, and you want your body in a parasympathetic state, not
Right.
a sympathetic state. And I talk about that in my book, how, fertility is more trauma related. And if you're not careful, your body soaks in the trauma because your body remembers. It's like when you go to a war zone, for instance, you see people, they call it shell shock, right?
Yeah, shell shock.
Yeah, yeah. So their body internalizes it. And when you do that, it pervades every single thing, right? So I do that in my book to teach about how you can shift your body set into a parasympathetic state, because you cannot conceive when cortisol is overriding everything in your
Yeah,
book.
fight or flight.
Yeah, yeah, yeah,
Yeah.
yeah. It's hard to do.
And then we talk a lot about women in the fertility space, but also there's like a male aspect of as
Oh
well.
gosh, yes, yeah.
I'm interested to hear your take on that.
I
So
think that's just huge. You just hit on another pet peeve of mine. People equate, male fertility with masculinity. And
yeah,
that is not always fair to men, right? You see this men, bodybuilders,
yeah,
strapping, and they have sperm issues, right? So, and the funny part is sperm parameters are getting worse as the years goes, right? Men are not as fertile as their grandparents were, right? And
yeah. It's
it's
changing.
environment, it's everything that's be impacting environmental toxin, heat. So one of the things I do in my book is to delve into that is how can you protect yourself, protect your future progeny, protect your future, children, your sperm
Yeah,
with what you do today. So that's really huge, right? Male fertility is more than 50% of the whole equation. No good sperm, no good embryos, right?
right.
So and we rarely talk about it. I actually partner with one of my colleagues is a fertility trained urologist. So when we get people who have very bad issues with sperm, I do a preliminary workup and then I work with my colleague to see what can we do to help them and improve their chances. It's like teamwork to do that.
Yeah, I really like that perspective. Is there a board certification for as a urologist for
I
fertility? I'm
think that, yeah,
curious.
absolutely. There's a fellowship training for urologists that, yeah, they're doing urology, but they're specific fellowship training programs in the country where they go through for like 2 years or so, maybe even longer
Yeah,
than that, is that focuses on male fertility. And so when you have a serious male issue, you want someone like that who's been trained for that.
yeah, it's very specific. Have you found like in an education piece as well as you're going through this with like the partners, is that like do you find that like diets help the male partner, or is there like
Yeah, well,
trends you've seen
yeah,
over time?
absolutely. One of the YouTube channels that I programs that I did is called Understanding Oligostenospermia. You can
Yeah.
look it for my YouTube channel. It's not just what people eat, it's also what are they doing with their body. Now, we
Mm,
have an explosion of marijuana use and cannabis use and THC. It affects sperm. I mean, the jury's out on it. It does affect sperm. So if you have someone who's smoking marijuana every single day, it's
yeah.
going to affect their sperm quality as well. Vaping is another thing. You have heavy metals in vapes. You have toxins in vape. So people who vape have issues with their sperm as well, right? So smoking, and if people take the so-called male vitamins, testosterone, because they want to bodybuild and get the muscle, you can take enough testosterone that it actually suppresses your brain signals that goes to the testes. And we see
Mm,
what happens is they eventually have no sperm. They've suppressed the production and they have no idea. I had a gentleman who was prescribed one of this from someone who was in Florida. I don't even think the person's a physician. And he bought it over the internet. He was using it. And, he was well built. They didn't know there was a problem until they try to have children and then do a semen analysis, come to find out there's hardly any sperm.
yeah, that's unfortunate. That's sad.
Yeah.
Yeah. That's part of the prevention though, how we can help these patients too, is with the education piece is like
Yeah.
before they even meet you,
Yes.
it's good to know, hey, I should just stop using it
Yes.
now
Yeah.
instead of thinking about it. So then when
Yeah.
they get
And
to you, it's
and
not as,
yeah, and let your sperm recover,
yeah,
you know.
recover.
Yeah. And maybe come in, get a semen analysis test so we can see where you are at baseline.
Yeah. I know it's different for every patient. When should people stop doing these things before they see you or really get serious about getting
Well,
pregnant?
I mean, well, maybe they shouldn't be doing it at all.
Yeah, they shouldn't be doing it all right, but
Yeah, I mean, it takes 72 days or so from start to finish to produce brand new sperm, right? So it's not, rapid. You stop
quick.
something, you're going to see an effect right away. It takes time for the
Yeah.
sperm to process through. So you might want to think about that when you're deciding
Getting
when to
ready.
stop. And then there's evidence that sometimes some of these effects may linger more than a year, right?
Mm,
So,
yeah.
prevention is the best thing. But if you want to understand that, what you do with your body as a man influences your baby and also influences your wife in the sense that we now know that, what's going on with the sperm can present challenges during pregnancy, right? The
Yeah.
woman could have preeclampsia, excessive high blood pressure because of the sperm. So if you want your wife to have a good pregnancy and you want your child to be healthy and normal, then please pay attention to what you're doing. Be selfish about it, what you're doing with your body. And if you don't
Yeah.
want to do it for you, then do it for your partner. Do it for your children, right? Because some men may not want to do it for themselves. Do it for your partner.
Yeah, it's a team effort, I guess is probably the best way to describe it in order to make things happen. So,
Correct.
and I think a lot of people come in before they even see, they have like a misunderstanding of they don't just go right to IVF, right? There's other things you can do before that step, right? Is before they jump right into IVF.
Yeah, yeah,
Yeah.
absolutely. It's not that you're going to do IVF right away. It's just the first thing is to see where are you? What's going on
Yeah.
with you?
Get
The
a
first
baseline.
thing is an evaluation because, it may be that all you need is just timed intercourse where I'm saying, well, yeah, I know why you're not getting pregnant. You're not having intercourse when you're ovulating or something like
Ovulating,
that,
right?
right? Or, we can guide you with ovulation kits or simple basic stuff. Or you may need artificial insemination. So there are a lot of basic things that you can start with first before you go into the heavy guide.
Yeah. And thank you for hopping on the podcast today. I really appreciate your time. Is there any other topics you wanted to talk about or discuss, or anything I left out?
No, I think we covered it. When the book comes out, let's have another conversation. The Quest for
Yeah,
Fertility, March 2026.
I'd be happy to. And I see a lot of different channels. Looks like you can be found on TikTok, LinkedIn, Facebook,
Yes.
Twitter, X, I think is what it's called,
Yes.
Instagram, and YouTube. So you can be found on multiple different avenues. And then your website too. I didn't even mention that, your website.
Montgomery Fertility Center.com is the website, all one word. And it has connections to all my, where you can find me.
Excellent. Well, thank you so much for your time today.
Thank you. Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famuyiwa.